What made you get into fertility care? Was it something that you always wanted to do?
We used to see whenever there's a baby who's delivered, whole of the family used to come and they used to hug each other, and at times the staff also distributing sweets. So I wanted to be a part of that happiness.
What's going on here? Why is PCOD as a case rising so much, and what is it?
The ultrasound reports label them you have PCOD.
Right.
It is nothing. It is just you have a lot of eggs. You are born with them. It's the nature of ovaries. Like somebody has a peaked nose, somebody has big ears. She has PCOD.
Hello and welcome back to Fertility Tales powered by Nova IVF, where we talk all things fertility, hormones, hope, and the unfiltered truths in between. I'm your host Simrat, and today we're putting the spotlight on a condition that affects 1 in every 5 Indian women, PCOD. Whether you're someone who's been told to just lose the weight and it'll all be fine, or you've Googled intermittent fasting at 2 a.m. wondering if that's your ticket to balance hormones, you're in the right place. To help us make sense of the medical, metabolic, and emotional dimensions of PCOD, I'm joined by someone who's been at the heart of women's health for years, Dr. Manisha Jain, Fertility Consultant at Nova IVF Chandigarh. She's a senior obstetrician, gynecologist, and an IVF expert with a decade of experience in treating hormonal disorders, complex fertility cases, and lifestyle-related reproductive conditions. Welcome, Dr. Manisha Jain. We are thrilled to have you on the show.
Thank you.
Let's start at the very beginning. What made you get into fertility care? Was it something that you always wanted to do?
A nostalgic question indeed, I must say. So when during graduation, we call it MBBS, during our training days. So when we were posted in the maternity wards, we used to see whenever there's a baby who's delivered, whole of the family used to come and they used to hug each other, and at times the staff also distributing sweets. So I wanted to be a part of that happiness. I became a gynecologist.
Okay.
And entering gynae, then I realized there is an extra feather of happiness in people who conceive after infertility, because these are the people who've been hearing so many things about them. Your eggs are not fine, your sperm is bad, your tubes are blocked, and so many bad things about their body, and not able to conceive that motherhood feeling. And suddenly that all is over, that taboo, that stigma is over, and they're fertile, they have a child. So probably that.
That's so novel, and it's so heartwarming that you wanted to make something good out of
Yes.
somebody's dismay, that you wanted to help them in that
Happy
case.
patients.
And you're right, infertility is a taboo, and there are so many factors that are associated with it. And one of the factors that we're also talking about today is PCOD. And you've, I'm sure, seen so many stories unfold in your clinic. But what is the most common type of issue or a problem that you see people coming?
As far as infertility is concerned, there are different sets of problems, of course. If you talk about younger population, this population typically has more of PCOD, as you just named, and the tubal issues, the blocked fallopian tubes, that's a connection between the ovaries and the uterus.
Okay.
So that's a commoner problem in young women. And when we talk about older women, it's generally a poor egg quality, as I generally counsel them that with the passage of age, there is graying of hair, you have fine lines, something of that sort happen to your eggs also.
Right.
Men, yes, all kinds of issues can happen at all ages, but of course, the effect of aging definitely affect the semen issues as well over time.
I want to zoom out a little bit, and a lot of us have heard about PCOD. What is PCOD? And it's often the first thing people think or hear when they think about PCOD is about hormonal or fertility issues. So, and especially in younger women, what's going on here? Why is PCOD as a case rising so much, and what is it?
Let me decipher this word PCOD. It's not one word. It is basically a small form of polycystic ovary disease, or PCOS. At times it is written polycystic ovarian syndrome. Polycystic means there are a lot of cysts.
Okay.
Every woman forms one egg in one cycle. That's a cyst. It's a common name for an egg in the ovary, a cyst. So these women have a lot of eggs. So it is polycystic. It is just a nature of ovaries. Nowadays, if you see so many reports, and because people are so up and about their health, they get full body checkups, or mild menstrual irregularities, they'll just rush to the hospital. The ultrasound reports label them, you have PCOD.
Right.
It is nothing. It is just you have a lot of eggs. You are born with them. It's the nature of ovaries. Like somebody has a peaked nose, somebody has big ears. She has PCOD.
Okay, so what comes along with PCOD? What are the symptoms? Why is it a problem then? If that's the nature of PCOD, then why is it a problem, and why does it lead to problems like infertility or hormonal imbalance? And we see that it's rising in so many women. So is that all interconnected?
Yes, it is. Firstly, we don't treat PCOD. As I just told you, she's born with them. She may not have symptoms. There are two types of PCOD. One who have a lot of symptoms or a few of symptoms. And a few PCOD women you will see, they will conceive normally. They have regular menstrual periods. They don't have any problems. They are just labeled PCOD. So that's how is the spectrum. Now, as far as the problems that can arise with the PCOD, which we need to treat, one is menstrual irregularity, which is very common. Second is inability to conceive. Third one, most of the times these women, they have tendency to gain weight.
Right.
They have hair growth at places where there shouldn't be, like on their chin or even the chest area.
Right.
They may have acne, and like that, the list goes on.
What are the tests? How do you diagnose PCOD?
PCOD has a hormonal testing and an ultrasound. In hormonal testing, there is a wonderful test called AMH.
Okay.
So a normal range of AMH is generally between 2 to 3.5 or so. And if it is way more than that, then it is severe PCOD. Slightly more than that, then it is just a simple mild PCOD, or PCOD is labeled. Along with that, we do an ultrasound. At times, the AMH is fine, but on ultrasound, you see a lot of cysts, as I just told you. So many eggs, they're studded. So much so that there is a name for it. It is called string of pearls appearance on ultrasound.
Oh.
Like you're wearing this pearl string.
Correct.
So it will be like that. There will be a lot of eggs just arranged in conjunction with each other and dotting the ovary. So that is also one of the ways to diagnose PCOD.
Okay. And what if your AMH is normal and you have cysts? Is it an either or kind of a situation?
Yes, it happens. It does happen. That is why most of the fertility specialists now rely on ultrasound more than on tests. And if the ultrasound is fine or is showing PCOD, we generally don't even get the AMH done. But for counseling purposes, for your, I would say, prognostic purposes, they keep a record over time. It's a good test. It's an objective test to keep in your file.
That throws light on how to diagnose it and how to get it diagnosed. But nowadays, in the lifestyle and the hyper intelligence era that we all live in, that we are all aware of our bodies and we want to read up about it and be more aware. When we get these tests done, sometimes when teens, younger girls, when they get tests done and then there's some sort of a menstrual, for any reason, it could be a menstrual irregularity or, they get the test done. What do you think? Should they be worried at that point of time? Like, should they start managing their symptoms from that time?
The answer lies in, yes, they should be knowing about it. Worried? No. As of now, no. As I just told you, that PCOD is just a label. Okay? So she will be labeled PCOD now.
Okay.
Coming down to the history, basically, it's very much in our frame. Every girl is born with a certain chunk of eggs at her birth.
Right.
And at puberty, they start ovulating. That is your puberty, when you start ovulating. So every month, a fraction of those eggs is used. They are there for your reproductive life. And as the reproductive life comes to its fag end, like 40s, 45, you don't get natural pregnancies after that. And they are just enough for the menses to come regularly.
Okay.
Till then, a chunk of eggs is used every month. So when you see them in that formative years, then she's just started menstruating, the teenage years, during that tenure, they must be having a lot of eggs. Because the more the merrier, as many eggs they have at that time, small chunk will be used for 20 more years. So when a random ultrasound is done during those years, you will definitely see PCOD known as physiological PCOD.
Okay.
So you need not to worry. You need not to put pressure on the mother's head or maybe the child, because they get an ultrasound from a radiologist who doesn't counsel, and then they come to the gynecologist or a fertility specialist. This is what is happening, and then they are stressed. You tell them right now nothing needs to be done. You just remember you have PCOD. In case you have problems which you just listed, like menstrual issues, like inability to conceive, acne, hirsutism, which is like excessive hair growth and all that, only then seek help. Once you get married, try to plan pregnancy early so that if there's a problem, you'll get to know early.
All right, sounds
That's
good.
it.
So it's something that you're born with. So is there something that women do or don't do that makes it worse? Is it like a lifestyle disorder? How does it happen?
Over time, it has become a lifestyle disorder. There are various things. First and foremost is weight gain. I get many patients saying, I got PCOD because I have excessive weight. To be honest, this is other way around. Because they had mild PCOD or like that, even on the higher side AMH and just that. And because they gained weight, the hormone imbalance happened. What hormone imbalance do they have? Basically, your body is set to produce, let's say, 1 gram of some hormone, a fertility hormone. And that was meant for 8 eggs, 10 eggs, which are the normal eggs she should have in an ovary. And now she has 20 eggs. That 1 gram hormone, which was meant for 10 eggs, is now distributed on the 20 eggs. They are fighting with each other. Like in a developing country, which is very populous, you are fighting for resources.
Correct.
Same way, those eggs, they are fighting with each other to become a dominant egg and ovulate and give that woman seed, which is going to meet the sperm and form a baby. But because it is not getting enough hormones, so it is not growing and causing infertility.
Metabolically, how can one manage PCOD,
Yes.
and especially weight gain, because it's such a chicken and an egg situation, right? Somebody has PCOD and they gain weight and they can't lose weight because they have PCOD and other related problems. So what is the ideal way to go about it with PCOD?
Whenever I counsel for a weight gain, it's a full half an hour counseling. I tell them ki many times patients feel that let's go for exercise. I don't get time. I'm such a busy person. I work from 9 to 7. How can I exercise? They just put whole of the focus on exercise to lose weight. When you want to lose weight, it is 70-80% diet. I would say not dieting, it's diet and lifestyle.
Right.
And 20-30% is your exercise or activity part. So if your diet is correct, as people generally say, I read somewhere, I really like the line, your body is what you eat.
Yeah, you are what you eat.
You are what you eat. So that's how the lifestyle part comes into it. The amount of water you take, the high carb food you take, they all have a role to play.
What I'm hearing is if diet and food is one of the villains, can it also be a hero? Can it heal you? And what kind of dietary shifts do you think you can recommend for somebody who's managing or trying to manage PCOD?
Diet, it's something like you pray. You pray to keep your soul healthy. You eat right to keep yourself healthy. It's a dictum. If you want to follow, don't take any packaged processed foods like, pastas or maybe instant mixes, instant poha and so many things like that. You say no to ketchups and anything which is processed, you're not going to have.
Okay.
You change everything to the natural source. Anything which is natural will not give you the calories which are difficult to process or have a very high glycemic index. Glycemic index high, this is something very commonly you must be hearing that this food has high glycemic index, this one is a good one. Basically anything which is rich in fiber, like brown rice.
Right.
It is why? Because the whole covering and all, it takes such a big amount of water to cook them.
Yeah.
If you've cooked brown rice, a longer time because it has that high fiber. You include fiber in your diet in the form of the atta you use in the house, the flour. You can add bran into it and like that. Anything which is high in fiber will improve the glucose metabolism. The sugars, your body understands only one language, which is sugar. Even if you take a cucumber, a slice of cucumber, it is going to get absorbed in the form of sugar. But the calories, suppose it gives 5 kilocalories, the amount of calories your body spends to metabolize it is 10 kilocalories.
Right.
It becomes a negative calorie food. So salads, dals, the soya bean, this protein diets, These really help whenever carbohydrate to protein ratio is good. Like you have almost equal or the protein part is more, you're going to not lose on the diet front. You will definitely have a better glycemic control.
So I'm hearing that one should consume a lot of whole foods, protein, lean meat, and try to avoid as much as processed food and bakery items for that matter. Um, what is your take on these trendy diets like intermittent fasting and keto? Are they helpful or do they more harm than good? Because this is something that every woman goes through, and that's the first line item when you search. So, do you think, what's your take on these diets?
As you rightly labeled, these are trendy diets. That's a trend. It's a short term measure, yes. These diets are good to reduce weight. If you have a target, like I don't judge that you want to get married and you want to lose a few kilos, and these both of them are good diets. Or maybe for fertility, your doctor has asked you to lose weight, only then she wants to start the treatment. It will help her to carry her pregnancy well. So she has a target.
Right.
For a target, for a short while, these are trendy diets. The keto diet and the intermittent fasting diet. Let's go into it a little bit.
Sure.
Keto diet, what is keto diet? It's a high fat, low carb diet. That means every energy that you're getting, you'll be getting from a fat diet. And your body it is a heavy food for the body. It is going to digest it, then convert it into proteins and other things, and then utilize it for day-to-day activities. Good diet, no problem. You do lose weight, but you cannot, if you take a keto diet, you read about it, you cannot go about it on and on and on.
It's not sustainable, maybe.
It's not sustainable. I'll tell you the reasons also. Then is intermittent fasting. Again, you are fasting for 12 or maybe 16 hours, and then you are allowed that window that now you can eat whatever you want. You are not given that key, you're not eat this, you're gonna not eat this, and like that. You're fine. You can complete your hunger and go on. Both of these are very radical. It is not normal. Anything which is not normal is not your lifestyle. It's a modification. PCOD as a whole or fertility as a whole will always need a lifestyle modification. So what you cannot carry for life, PCOD is a lifetime problem. As I just told you, you are born with it, you have to live with it. So you will conceive, you get your period straight, you had some other acne issues and all that, they got fine. And eventually you leave the diet. They're back again. You're back to square one. So try to have sustainable things which you can do. These diets will leave you nutrient deficient because in keto diet, you'll be avoiding so many things which are going to give you minerals, vitamins, and in general, a satiety. You have to have that normal lifestyle. Just having those hunger pangs and staying hungry all the time. You're going to a party, you're going to a wedding, you're attending an event, and you're just vouching for the fact, oh God, I get something to eat.
Yeah.
I hope she's kept this one in the menu so that I can eat. It doesn't happen.
I think these are quick fixes that we are trying to grapple onto to try to solve the problems, because they say even 5% of weight loss, if you do, it helps quite a bit.
They really help.
What about exercise in this? What has that got to do in this? And can you actually outrun a bad diet? And does
No.
it help? So
surely no.
how does exercise come into play? And is there a specific type of exercise that you should do that helps with PCOD management and infertility issues?
Definitely. As far as exercise is concerned, as I just told you, it's just 20-30% of it. When I do it, so I apply it in two ways. When you exercise, first, you feel like keeping yourself in the timetable of the diet also. If you're following a diet, or for that matter, you want to do a lifestyle modification along with exercise, you feel like I've burned so much,
much
of sweat, and I don't want to eat bad.
That is so true.
Okay, so it felicitates your, it awards your diet management, one.
That's true.
Secondly, active lifestyle will definitely help you in so many ways, your joint, your everything, and you will definitely burn some kilos. Specifically placed exercises and a regular daily workout. I read somewhere which was very good. It's a scientific thing. They say at least 20 to 30 minutes. 20 is the minimum, but if you can extend to 30 of aerobic exercise a day. even if 5 times a week is ultra important, and that's all you need along with diet.
Okay.
And out of that, if you can add 12 to 15 minutes of rigorous, we call HIT, or maybe just skipping the rope, or you're doing the jumping jack stuff. So if you're doing that high intensity aerobic exercises, they are going to help even more. And just 20 minutes, imagine. Just 20 minutes. If you see your screen time on Instagram, Facebook, WhatsApp, we have that app.
When you put it like that, when your
Right?
average screen time.
Minimum
Yeah.
1.5. A busy person, I would say busy, who works day in, day out, like even doctors. So many things. WhatsApp has become a modality of so many things, the connection, the communication, so many documents from to and fro. It's a lot. So if you can spend, and just scrolling, just relaxing. Now relaxing is, scrolling reels.
That's
So
right.
you can take out 20 minutes. Even if you are not a PCOD patient, even if you are not obese, you should take out those 20 minutes. They are yours.
Yeah, these are lifestyle changes that everyone, I think, has to make and actively work towards. What about strength training? I've heard so much, read so much about it, and especially for women who face hormonal imbalance. What do you have any
Strength
thoughts?
training is modern lifestyle problems. When the women were not working, they were working in homes. They were doing that cleaning and sweeping work. Even if you think about cooking everything yourself, putting dal ka dabba somewhere, and taking out the flour from the
That's
drum
true.
and
They
all
were
that.
active. They were doing more of household
So
chores.
much of things, even the dusting part and all, you were just hopping some stair, that thing
Right.
which you keep, and you're dusting, you're doing the other chores. Now you don't do them. So you have to do strength training, at least the stretching exercises, your joints, the lubrication of the joints. You must be hearing, I don't know, you're very young for that, but at times parents are in that age group, they are getting their knee replacements, hip replacements. Why are they happening so rampantly? Because we don't do any stretching exercises, or for that matter, these trainings which help to lubricate our joints, and eventually there are problems.
That's true. And it obviously helps in the whole of scenario, the whole of
Holistic growth as a
holistic
person.
growth. Doctor, now the big question, can we actually treat PCOD, or is it something that needs lifelong management? I think you have partly mentioned it.
Yes.
But
We don't need to treat PCOD, but we can really treat all the symptoms of PCOD by so many things as they come. By as they come, I mean, if she has menstrual irregularities, she can very well have things to get the withdrawal of their periods. There are several simple drugs not going to affect them. Many women, they say, is it going to harm my body? Is it going to have side effects? I would rather prefer going for a homeopathy and like that. They don't cause harm. It is very important for any woman to bleed for at least 4 to 6 times a year.
okay.
At least. Obviously, monthly periods is definitely a thing, but if the menstrual irregularities are there, don't just keep on sitting saying, I don't want to have medicines. Yes, you need medicines. If you don't get periods at all for months together, you're going to be predisposed to many cancers and so many other things.
That's true.
Menstrual irregularities, then are fertility problems. If you are not able to conceive, as I told you, your eggs may be fighting with each other for the fertility hormones you've got.
Right.
So you might need very small amount of fertility hormones. Definitely visits your fertility specialist and get those hormones to ovulate and conceive like blink of an eye.
So what I'm hearing for anyone actually, even if a woman is struggling with PCOD, they have to have a holistic approach towards lifestyle changes and lifestyle modification, because there's no one size fit all for everything. Either you take the medication route or you fix your lifestyle, and with that comes your diet and exercise.
At times both.
At times both. And which is the key to a happy and healthy life. So I think your body is asking more for you to take that holistic approach rather than take the medicinal route. But since we're on Fertility Tales, I want to ask more about the PCOD aspect and infertility, and how long do you think a person can go without keeping it unmanaged?
Yes. PCOD, basically, it's at times very simple to treat, and at times it's very difficult to treat. Even at times, mild PCO people don't conceive at all. And at times, very severe PCOD people conceive within a couple of cycles or even the first cycle with very small doses. So it's a very intricate balance. At times, patients really listen to you, are compliant enough for everything you prescribe them. They do a weight loss. And even that, I have seen so many times that weight loss journey they have, during that journey, when you supplement with the drugs, it really helps. It really, really helps. They lose weight, they are active, and they are getting that small missing block of fertility hormones. They conceive right away. And those who have had a lot of treatment, or for that matter, are severe PCO patients, should not think twice before seeking expert care in the form of IUIs or IVF per se. They are very good patients when it comes to IVF. PCOD patients generally conceive very well because mostly they are young and they have a lot of eggs, so they conceive very well.
So PCOD, if not managed, there are fertility treatments that help you achieve a pregnancy even with PCOD. But first route, I'm sure, is to go with lifestyle modifications and changes. We've spoken about diet, we've spoken about exercise. Let's talk about some lifestyle habits, which I'm sure every listener of ours is guilty in some way or the other. Let's talk about caffeine, smoking. These are the ultimate modern day enablers which help us get through the day. So smoking, caffeine, alcohol, and the other aspects of modern lifestyle. Do they affect
Simrat,
PCOD?
why did you order this coffee?
I
Just
wish.
like that.
I
Today,
wish.
just a while ago when we were just discussing.
It's the caffeine, right? The caffeine that helps.
What was the feeling? Why did you need coffee?
Alertness. That's it.
How come that alertness came with a coffee? Because it increases the cortisol levels in your body.
Right.
That's a mechanism of action of caffeine. Smoking. So many things, they increase the cortisol drive of the body. So it's basically a sympathetic drive हमारी body में हमें जब भी कुछ urgency होती है, so that sympathetic system of our body, it activates.
Okay.
That works with cortisol. That works with the steroids in common sense. Steroids are normally secreted in our body. They're not just the pills. So when you take coffee, you take smoking, any carbonated drinks and like that, you feel that energy because the cortisol levels increase. These are causing insulin resistance. You can read about this. Anybody who's watching this thing, they can read about insulin resistance is the main problem thing in the PCOD patients for every problem they have eventually.
Okay.
This cortisol that is going to increase that everything, the insulin resistance and all that, because of which they have problems. So permissible limits are there. Definitely you don't need to stop everything. You can have a couple of cups in a day. Maybe this is a fine cup. If you take just 2-3 cups a day, it's fine. And no amount of smoking is there. You hear about it. Patients don't agree. At least men, they're very resistant. One, it definitely causes PCOD, especially in women. And secondly, it is going to give a lot of oxidative stress to the body. It is going to cause decreased egg quality and in case of males, sperm quality.
Right.
Smoking, no, big no. Earlier, there used to be studies, they used to say 1 pint or just 30 ml of alcohol, small wine, small beer. It's good for heart and so many things used to come.
Right.
But the recent studies which have come up, basically women somehow, at least in Indian society, they have now gone to equal to men in consuming alcohol. Alcohol is equally bad.
Right.
Earlier, it was thought that it is fine if you take it in small amount like caffeine. No. Alcohol is also bad.
I think everybody who's on this wellness journey to, to start their fertility journey, I think somewhere everybody knows the do's and don'ts. But I think when it's more said and more pronounced,
Yes.
it makes all the more difference because it's not just that one smoke or it's not just that one cup of coffee. It's not just that one pint of beer.
True.
It's a holistic approach that you're trying to take to, and you have to be your healthiest self to be able to conceive. I believe that's what I've been hearing about all the conversations that we've had about
Two interesting
life.
things I'll tell you here.
Please.
One is the day they conceived, you need not to tell them, they stop alcohol and smoking. Right. That means internally they already knew that.
Right.
One. Secondly, if you just observe males around you or those who drink around you, apart from that drink part, they are consuming so many calories along.
Right.
They are empty calories. You're having fries, peanuts, and so many other things, fried food. You have to have something going on, eating and eating along with. That also adds, along with the empty calories you get from the alcohol. It is what you eat, the fried stuff. So this is whole is a, one thing leading to other.
That's true. And we can't not talk about stress here also. Stress is the easy villain, or does it actually make it worse? PCOD. I mean, stress is something we all can't avoid. We all live in environmental stress or work stress or personal stress, everything. And especially getting to try to start your own fertility journey. I'm sure that's also very stressful for couples and parents and everybody involved in that process. So what role does that play into managing PCOD, and how bad can it get?
Stress is something in our scenario, in our generation, this whole meta phase we are here, we cannot avoid. It's very easy when I'm sitting in my chamber, I'm sitting on my chair, there is a couple, please beta stress mat lo, this will happen, ho jayega, don't take stress, this doesn't serve.
It's easier said than done to ask somebody to not stress.
Precisely. So I tell them two things. One, don't stress about the fact that you're stressing, that is why it's not happening. Anybody who's going to visit a fertility clinic is going to feel stressed a little. So it's okay. You will conceive, just believe in your body. One. This somehow at times sounds very, superfluous kind of a statement that how is it possible and not. You can do various things to combat that. One, if at all you find yourself capable of, you can do 5-7 minutes of meditation and yoga. Anything, 10-15 minutes, whatever, or any music, any chanting, anything that gives you calmness, some Gayatri mantra, Namyo Myo Renge Kyo. So many things are there which you can chant to give yourself a good start of the day. This is start of the day. I believe in myself. I believe that I'm doing this to heal the stress I'm going to get in the day. Second, before sleeping, do yourself a favor and switch off all the devices for 1 hour.
Okay.
If you want to sleep at 10, switch every device at 9. Contrary to that, most of the times, to be honest, at times myself, if you're not able to sleep, you say, let's scroll a little. Let's just pass time. I'm not able to sleep. What should I do? Let's have a Netflix kind of a thing. Get bored in that 1 hour. Try to get bored and sleep will come. Sleep, because we are talking about PCOD, if you or those who are watching the episode, if they think about the fertility medications they've been prescribed, the antioxidants and so many things are prescribed to them, many of them contains melatonin. What is melatonin?
Yeah.
It is, if you are acquainted with that jet lag thing, now the medications have come to take care of the jet lag.
It's that, and also people take it to go to sleep.
Go to sleep. So melatonin is secreted from a small gland inside your head. It's called pineal gland. You read about it. So it is the one which wakes up with the sun and sleeps with the sun. That schedule, we talked about the fact that you should sleep properly.
Right.
So a dictum, mantra is about 8 hours of sleep a day, as much as possible. If you can make it 7+1 in the form of 7 hours at night and 1 hour in the afternoon, very good. Some people do that also, but they do it at a wrong hour. Many youngsters, even my own brother and so many other people, they will sleep around like 12, 11:30 and then they'll wake up at like 8, 7:30 because they have to go at work at 10. So these 8-9 hours of delayed sleep is also not right. Though you are completing those hours, but you're not doing it according to the circadian rhythm you should be following. Because of that disrupted sleep and that weekend culture, we will, backlog
Make
will
up
be
for this lost sleep.
On Saturday, Sunday, it is not. It is a daily basis completion of those 7 to 9 hours. So when you disrupt that sleep cycle, you are going to create more PCOD type things. That is why melatonin is added in most of the antioxidants. You improve your sleep cycle, the stress will be less. In the morning, very less people are stressed.
That's true. And then the day gets to them. And stress definitely does play a very important role. We've spoken about stress, we've spoken about diet, exercise. Again, a more holistic approach. You mentioned melatonin and the supplement that people now take. Let's talk about supplements a little bit. People think popping a multivitamin will help for the deficiency that they have, for anything that they're struggling with. Are there any specific health supplements that help PCOD managing?
There are many, to be honest. And so many of them are just focusing on the fact that PCOD people are insulin resistant, as we just talked.
Yes.
I hope they are basically what diabetics are insulin resistant. It's a pre-diabetic stage they are suffering from in one sense, or some other form of insulin resistance they are suffering. Everything comes out of it: the acne, the hair growth, the inability to conceive, the menstrual issues, they all come from the same fact. So most of the supplements, they are focused on improving that insulin resistance.
Okay.
If you can do it with the other means, very well. But yes, there are prescription drugs, and there are few over-the-counter things like vitamin D.
Yes.
It is very good, a supplement like that. Zinc, magnesium, many supplements you would see. Omega-3 fatty acids.
Okay.
These are good antioxidants. But those who take a balanced diet, who take care of their protein, who take good veggies, fruits, colored vegetables, this is something very interesting. The pigments, they are very good antioxidants. Like jamun these days you get. And then coming this whole cranberry thing, the whole this blueberries. These purple pigment, they say it's the best antioxidant.
All right.
Avocados. So these things are good. They give you good antioxidants but from diet itself. Then you're not to just pop a tablet and take those excipients for no reason, and just work on your lifestyle.
That's very insightful, Doctor, too. And I think in this whole episode we've spoken about PCOD, what happens with PCOD, how to manage it, how to get it diagnosed, how to live with it, and also how to plan your pregnancy around it. When do you think a person struggling with PCOD should come to a doctor?
Yes.
Should start planning if they've been diagnosed with PCOD? When do you think should they start their fertility journey, or should they be little cognizant of the fact that yes, that they have PCOD, and then this is the way that they should go? What do you have to say about that?
This is one of the most important aspects, when to seek help. Most of us just don't know when to seek help. One, whenever you are diagnosed with PCOD, just keep it in some back of your head that yes, I have it and I need to be proactive about it. So first visit, I think, should be on this preconceptional counseling, which we call.
Right.
Once you are married, even if you are not planning a baby right away, you should visit a doctor and get a preconceptional counseling done related to everything. Your general hormones, the thyroid part, there's so many things, which help. Even there are certain simpler genetic tests like thalassemia, so many things that can come into play over time.
All right.
So that already people are marrying late, already they're conceiving late. By the time they start for conception, they're 32, 33 years of age, and then the things come into light, then you start treating them. And most of the good age to conceive is over by 35. So immediately after marriage, you should know your chances. You should be a learned person to push your fertility, how much you can push your fertility. One is that. And then comes the problem part. You're not menstruating for months together. You're not able to conceive despite of trying for more than 1 year, 1.5 or maybe more. You should definitely seek a fertility expert. Many times people feel that they will, give us stress. No. At times they just tell you you're fine. Just listening from a learned doctor, as we call it, a horse's mouth, that you're fine. It's a lot of reassurance.
Sometimes maybe that's all you need to hear to reinforce the dedication to something that you're doing.
And if they are informing you that something is a problem, you should take it seriously. You should not take it, there is a problem and you've got it, you should feel fine that yes, I got it early and I'll work for it.
Right.
Why not?
Doctor, let's take a feather from your cap and discuss some heart-touching case study that probably you had. And would you like to talk to us about it?
Touched my heart, to be honest. whenever somebody conceives, some IVF case comes positive, and when the best part about being a fertility specialist, you wake up and you get those positive pregnancy test kits, that is very heartwarming most of the times. You are happy always because of that. But one girl I remember, so she was infertile since very, very long and was taking medications of all sorts, tried so many cycles of medications, hormones, and she walked in labeled PCOD since very long. Used to ovulate also on those medicines, but never conceived. So then she was like, you do an IVF for me. I want to go ahead with that. I thought, let work you up. There's a specific thing called, it's a genetic disorder called adult onset adrenal hyperplasia, in which there's a genetic problem, again, cortisol, which we just talked about. That's a cortisol issue because of which there is insulin resistance and PCOD in such women. So we tested her, of course. There is a battery of tests which we run, and again, there's a few supplements and all that. And eventually, I told her, you just need this medication. You take it for a couple of months and you come back to me again, and then we will reevaluate and do that. So she took it for good 2.5 months, and she conceived in that very cycle. Just by that medication, because you worked her up according to her profile. She was a tall female with a lot of hair. Some things at times, they are just labeled, as we have been talking since very long. They need a special, look to give them a customized treatment. This customization per patient matters a lot to so many of them. Empathy, you're telling them that there is no problem itself. These things matter too much and gives them a lifelong hope that PCOD is just something which is running. I should be taking care of certain parts. That's all.
Thank you so much, Doctor. This has been such an insightful ride. We've learned so much about the condition, how to manage it, and how to have a more holistic approach towards PCOD. And I've managed to make some notes for myself also, which is great. So it was really nice to have you on the show, Doctor. Thank you so much.
Thank you, dear.
If you're someone navigating PCOD, know that you're not alone. And more importantly, you're not powerless. Small shifts in how you eat, move, and even think can truly change the game. If this episode helped you, please share it with a friend and help spread the word. Let's keep making hormonal health a mainstream conversation. I'm Simrat, and until next time, remember to stay kind to your body. It's smarter than you think.